Hi, I'm Lisa Cheek. I'm a pelvic floor physical therapist and certified lymphedema therapist at N2 Physical Therapy in Denver, Colorado. We've been talking about what's normal for pelvic floor health. We've talked about bowel dysfunction, bladder dysfunction, and now let's talk about sexual dysfunction. And this can be another difficult area for people to talk about. There's a lot of emotion wrapped up in it. This realm of our lives has a lot to do with our relationships, our emotional health, and can really be a tough thing for people to seek help with. In my practice, what I see most frequently is pelvic pain. And in particular, patients come to me and tell me that sex is painful. And not just that sex is painful, but that sex has always been painful from the time they became sexually active. Now, this is an area where many patients will be conditioned to a new normal because this is how it's always been. And so I hear patients all the time ask, well, sex is just supposed to hurt, right? And particularly in my patients who've been treated for pelvic cancers, have had surgery, radiation, various traumas to the pelvic region, many of them have the expectation that, yeah, sex is just going to hurt from now on. And like I said, these are very complicated issues. There are physical characteristics that may lead to sex being more painful for an individual. One of the things I see most common is hypertonicity or tension in the pelvic floor muscles. And there's a lot of reasons that muscles can become tight and tense, but a big reason that they become tense is if there's been some sort of trauma. Surgery is a big trauma to any muscle in the body, and your body is going to perceive that as an injury. When there's an injury, the nervous system becomes hypersensitive, overactive, and goes into protection mode pretty much. And so when the body is in protection mode, what does it do? It tightens up. And it wants to protect and keep anything painful away from the injured area. Now, this is useful if you have been acutely injured, but in the long term, this is basically a maladaptive response in the body and is not considered normal. Other things that can cause sex to be painful can be scar tissue restrictions. Many of my patients who have had children, had tearing, had episiotomies, will have old scar tissue that has become extra sensitive over time. And also any scar tissue that's residual from surgery can be extra sensitive. And just general nervous system overactivity. The role of the nervous system plays in pain really can't be overstated. Your nervous system, part of its job is to protect you from danger. And when something has happened that, the body has been conditioned to this response of pain, then over time, your body's going to learn to tense up, to protect, to become hypersensitive, and this can definitely lead to painful sex. In the context of cancer treatment, cancer is one of the most threatening diagnoses that a person can receive in their lifetime, and many of the treatments can be quite traumatic, and this is going to lead to that nervous system hypersensitivity, which is going to lead to tension in the muscles, trigger point formation or knots in the muscles being formed, and basically overactivity in the nerves that control touch sensation. So sensations that used to be perceived as just light touch are now perceived as pain. Now, this is not to say that pelvic pain is in one's head. It's in the nervous system, but that doesn't mean it's in a patient's head. These are actual structural and chemical changes that happen within the nervous system when you've been in pain for a long time. So all that to say that painful sex is never considered normal. It might be common in some situations, but it's not something that patients just have to live with. Now, we've been talking about how long, patients might wait to see it when they're in pelvic floor rehabilitation, how long patients might have to wait before they see results. Now, pain issues are a little bit more complicated than just say, strengthening or coordination. Pain is complex, pain is multifaceted, especially when it's pain that has to do with something so emotional as sex. So it can take a little bit longer to sort of unwind some of these issues, unpack some of the traumas that might have caused the nervous system to become overexcited, and really empower patients to take control of their own treatment. That's not to say that patients won't see relief quickly, because some do, but these issues can be a little bit more complex. But all that to say, patients do get a ton of relief from pelvic floor physical therapy if the cause of the pain is determined, the right treatment plan is put in place, and patients are compliant with their self-care regimen. Then people see a ton of relief.